Welcome back to EU podcast series, What Do Young Urologists Need to Know? This is segment 3, where we discuss how to pursue academic excellence in urology. In this episode, we are joined by Professor Bhaskar Somani, consultant urological surgeon and a neurologist at University Hospital Southampton in the United Kingdom, and Dr. Geraghty, a urology registrar at Newcastle upon Tyne Hospitals Trust. Dr. Geraghty has recently started a PhD at Newcastle University. Together, they will discuss how to start your journey in urology research and academics. Join us as we embark on this informative journey.
Welcome everyone to this podcast, which is all about starting your journey in urology research and academics. My name is Bhaskar Somani, and I'm a professor of urology at Southampton University in the UK, and also in a number of EAU panels. I am joined this day by Dr Geraghty, who is a good friend and also a member of EAU guideline panel for urolithiasis with me. How are you, Rob?
I'm very well, thank you, Bhaskar. Thank you very much for having me. For those of you who don't know me, I'm a urology registrar in Newcastle, and I'm studying for my PhD in artificial intelligence related to stone disease. So as Bhaskar said, I'm also an associate member of the EAU guidelines panel on urolithiasis.
Rob and I have been working together for over a decade now, and we just want to have a feel about what Rob feels about mentorship. Rob, tell us something about mentorship.
Yeah, so you've been a mentor to me for probably about a decade now, and I think having a mentor is essential for growing your career. Would you agree?
Absolutely. You're correct there. Yes, Rob.
So how do you think people should approach would-be mentors?
I think the best way would be to identify somebody whose research interests align with yours. And broadly speaking, either drop them in an email or ask for a meeting or network in somewhere like an EAU Congress, because most people come to that. And that's a really good opportunity. And that's where the face-to-face meetings like the EAU annual meeting or some of the other EAU meetings really help, where you can really do a one-to-one conversation.
Absolutely. So do you think it would be good to have someone in your specialty as your mentor? So I'm thinking of myself, my PhD supervisor is a renal physician, for example. What are your thoughts?
Ideally, yes. But that doesn't necessarily mean you have to exclude people who would otherwise be an excellent mentor. So having it in your specialty helps because they can identify with, your goals and what you want to do. But I'm also thinking it's important that the would-be mentor takes a whole picture of your career and points you in the direction of interesting opportunities, which might be beyond your own specialty, just to explore newer areas as well.
So you mentioned that you think your mentor should ideally have research interests aligned with your own. Can you expand on that at all?
Yes. So this could be a subspecialty of interest. For example, both of us are interested in stones. But this could also be a type of research that we're interested in. AI, for example. Much as in medicine, there are subspecializations within research, such as trial work, lab research, data science, and lots of things in between. So pick up someone whose interests, whether subject or from the methodology point of view, it doesn't really matter, but it aligns with your own, because having completely different research objectives and interests probably will not help because you're thinking differently. But otherwise, aligning it would be really helpful, actually.
Completely agree. So flipping it on its head a little bit, what attributes would you look for as a mentor in a mentee?
Oh gosh, that's a hard one. I think the first thing is, as you said, that the research alignment or the interest alignment is useful, and them having some degree of knowledge or some degree of awareness about what you do, but ultimately some enthusiasm, reliability, and promptness. So there's an engagement, but also meeting deadlines and honesty about what you can and can't do. Because people can always work on their deficiencies and weaknesses, but if you don't realize your deficiencies and weaknesses and overpromise and underdeliver, that should be avoided, really.
That makes sense. So why don't we move on to the benefits of an academic career? Clearly, you've enjoyed, the benefits of both. But what do you think are the benefits of an academic career over a completely clinical one? Certainly for me, at the bottom end of things, I really enjoy the variety, as well as having the opportunity to potentially change clinical practice.
Yeah, I think an ideal job for most urologists would be clinical. And that's what people train for. but with a varying mixture of academic input in it really makes the job more enjoyable. I think academic career helps the clinician in keeping up to date with what is latest in their field of surgical or medical intervention. And equally, clinical career allows them to flag the areas of academic interest that can be researched on. And ideally, a healthy balance between the two fosters that relationship within yourself of being a clinician, but also having that research input from time to time. And ultimately, I think having this mix really helps your patients because you get the best out or you are more aware of what's happening around.
Absolutely. I think you get the best of both worlds, don't you? Why don't we move on to academic skills? So, in terms of academic skills, I've found coding to be completely invaluable. But if you had to learn one academic skill now, what would it be?
I would agree with coding. I think it's relatively easy to learn and probably allows you to be very versatile in terms of your analysis that you can do yourself without having to rely on others. And a basic grasp of coding helps enormously when tasked with specific analysis that you haven't done before. Rob, tell me something. I know you have done so much work in this area. What coding language do you think people should learn?
Yeah, I think that's a really good question. And I think it depends on what you're trying to achieve. So for us in medicine, we're primarily analyzing data, and R is a really good option for that. And it's got a really good user interface called RStudio. However, Python is probably the other language people have heard about for data science. It has the added benefit of being a general purpose language. So, for instance, you can also use Python to build applications, for example. So I think it just depends on what it is you want to achieve with your coding.
Okay, fine. That is very helpful actually. So some sort of coding and some sort of understanding is good, and so people should start early.
And what expectations would you have for someone in the first few years of their research career?
I mean, I think that probably sometimes depend on their research aspirations and the aspirations of the team or the mentor. But I think getting a paper or two under your belt is a good start. Usually, if they have got good basic science or projects going, you can involve, or a systematic review and meta-analysis is also a good place to start. And the advantage is that the latter can be done from anywhere. But I would expect you to have guidance on doing them well. Other forms of research sometimes can take longer to achieve, and you rely on primary data. But if you get involved in a trial or basic research in a lab, then actually it is also very beneficial. But remember, some of the research would involve the team, and you might join an existing project or start a new project. But I think team working is also really very important here.
Yeah. Are there any programs do you think you could recommend to help people develop skills that we would recommend?
Yeah, I mean, there's so much out there, Rob. The list is really sort of endless, and depending on what you want to do. So for review work, the EAU actually runs a systematic review course, for example. There are lots of online courses for coding. For example, there's a data camp. How about also run a free online introductory courses? So there are lots of courses, but it really depends on how you want. And remember, even in the annual meeting, there are some courses on how to publish and present and so on. So you can really benefit from the EAU and the European School of Urology bank, which already exists, and then attend some of these courses either online or in person in the annual meeting. And these things can really help shape your vision, your understanding, and how you want to progress in your research.
That's really helpful. Why don't we move on to networking? We briefly touched on it earlier, but I'm sure you'd agree with me that as you become more experienced and heads towards becoming an independent researcher, collaborations become absolutely vital.
Yeah, I completely agree, Rob. I mean, I think collaborations really are key to impactful research. Just look at all the latest research that are being conducted, and a vast majority of these are collaborative. And what it does is it helps you to transcend these barriers of national and international boundaries within urology. A lot of excellent prospective trials and high quality studies have been achieved in urology because of these collaborative network. And what it does is it brings the best people in that collaboration for the best jobs. And together, that team really flourishes because you understand the strengths and weaknesses and work with each other. And I think that is really the future of research, really. Single person, single unit research will happen, but really the big impactful papers will come from multicentric whether it's randomized studies or collaborative work.
So I think a lot of people listening will be wondering how they can get involved in collaborative research. And I know that BURST, so the British Urology Researchers in Surgical Training, they often recruit for new members. They have recruitment rounds, so people could look out for that. And they certainly recruit internationally. But I think a wide network is perhaps more important and is absolutely key to developing fruitful collaborations. Have you got any advice on how you'd start networking?
Yeah, I think, Rob, the most important thing I learned in my career is to be involved. It could be either seeking out studies or investigators, expressing your interest, or joining existing studies, or sometimes initiating studies and getting your colleagues, friends, and other clinicians to join in. You mentioned about collaborative research, and the EAU also, for example, has the Young Academic Society and the ISRU. And if you're a young researcher, you can apply and you can be a part of that, and you can start early. And similarly, there's so many other subsections, depending on your interest, that you can join and you can flourish and make the most of it. Of course, some of them need you to have some academic inclination, but some of them, by purely doing clinical research, also can help. And ultimately, in time, as your reputation gets out, others also seek you out to join their studies and recruitments. And then there are other forms of networking, right? For example, attending national and international meetings, speaking to investigators of the studies, or attending workshops where these aspects are being discussed. But remember, ultimately, it's about getting your interest out there, and usually others are willing to take on an enthusiastic and interested person in the studies also. So I think overall, the message would be that urology research and academics really is very fruitful and helpful. Start early, make those connections. Collaboration is the key. And if you are interested, people will be interested in you as well. Any other final words, Rob?
No, I think you've covered it. But thank you very much for having me on.
Thank you once again to the European School of Urology and to the podcast team for giving us this opportunity. And remember, you have to start somewhere, start early, and enjoy both a mixture of clinical and academic work. Thank you so much, everyone.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.